Doing negatives has been a strength training hack for increasing muscle strength and muscle size for quite some time. I'm going to walk you through what type of training this entails and how doing negatives affects both health and performance in people with and without type 2 diabetes. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. When doing strength training like weightlifting, in most cases people are doing what's called an isotonic contraction. This is where the muscle changes length and this causes movement of a joint. This is different from an isometric contraction where the muscle tightens but no movement happens. An isotonic contraction happens in two different phases. First is the eccentric phase, and you can think of this as the easier part of the lift. This is where your muscle is going to lengthen and the weight or the resistance that you're using is being lowered. Think of a bicep curl. As you lower the weight, also known as the eccentric phase, the muscle lengthens. The other phase is the concentric phase, and you can think of this as the harder phase of the lift. This is when the muscle is shortening and we're trying to actually lift the weight. So this would be the upward phase of the bicep curl. Now, if we think about these two different phases of the lift, it's kind of obvious that we can move more weight in the eccentric phase compared to the concentric phase. So think about it if you're lifting and you're really challenging yourself, or you're using a weight that it's too heavy for you. So chances are you're probably going to be able to move that weight in a controlled way through the eccentric phase, but when you go to lift it or try to take it through the concentric phase, it might not go anywhere. Because we can move more weight in the eccentric phase, one strategy for increasing strength is to spend more time in the eccentric phase. And these are called doing negatives. So when people do negatives, typically they'll spend usually between 3 to 5 seconds in the eccentric phase, and then it takes about 1 to 2 seconds to move the weight through the concentric phase. If we're thinking about the total number of reps that we can do, if we're training in the eccentric phase only versus the concentric phase only, typically if you're doing a bicep curl, you'll be able to do anywhere between 1.5 to 3 times more reps in the eccentric phase, and about 1.5 times as many reps for a back squat and a bench press with the eccentric phase compared to concentric.